where we walk you through different types of holistic healing in an effort to improve your spiritual, physical, and mental well-being. Today's show is going to be about meditation and the impact that it can have on cancer and how it helps to cure cancer. And I'm very happy to have with me today Ron Navarre. Ron was my hypnotist when I had cancer. Just as a brief background, I've had cancer 3 times, 3 different forms of cancer. And when I first started working with Ron, my cancer had metastasized. It basically went from halfway up my leg to above my hip. And the doctors couldn't find the primary tumor, so they said I had a year to live. And I started working with Ron, and that was 10 years ago. And
you're still here.
Which is amazing, and the doctors can't believe it. And I really think a lot of it had to do with you. So tell me, how did you get into hypnosis and dealing with cancer?
Well, I'm not a hypnotherapist per se. Right. I'm an energetic healer, Reiki master, shiatsu therapist, light body ascension therapist, and I teach Tai Chi, Qigong, yoga, and meditation. Within that, there are...
Which makes you a hypnotist.
Well, in a way. I guess there are meditative techniques that are classified, I guess, the same way as a hypnotherapist type of working. So with you, we had several sessions where I took you into a very deep state of relaxation and connection in which you were able to activate energies which were really important for your healing. So I guess in that regard, yeah.
Well, could you just sort of walk through what happens? Someone comes to you and they have cancer, and it's an advanced stage. Just mime what you would do. I mean, you go through...
Well, the first thing is I do an assessment, get as much information as I can.
Just by talking to them?
Talking to them, what are they dealing with, how long have they been dealing with it, try to get their medical background, what therapies they're taking, what treatments they're currently undergoing, which doctors they're working with, do they have any supplemental alternative therapies that they're working with. So I'm trying to assess really like what their strategy and their approach is first and foremost.
That's very interesting, as opposed to coming in and giving your impression about what to do. You get their...
Right. I think it's really important to understand how a person views their condition and if they have a strategy. Now, many people don't. They find out they have cancer, they go to the doctor, they do exactly what the doctor says to do. Even if that's the case, and they hear about me, and ask me to work with them, I'm going to honor their intention. Right. And if they say, this is what what I am going to do, I'm going to do exactly what the doctor says, I'll say, great, so let's stick with that. At the same time, there's more that you can do. You can take charge of your process. I think it's really important for people to educate themselves. So a good friend of mine just found out he had leukemia and was hospitalized. And the entire time he was in the hospital, he was researching his condition. He was researching it from different perspectives, different types of doctors, and he was also researching different types of therapies. He also researched what medications they were giving him. Anytime they wanted to give him a medication, he'd say, okay, hold on, let me look this up and see what information there is. I think that's very proactive, and I encourage people to become proactive because you're going to have a better result that way. If you're passive, you're basically going to live according to someone else's agenda. And if the doctor, as in your case, said you have a year to live, when I met you, you were pretty much set up for that year. Right. And then one day we got together and I said, do you agree with that? And it was like a huge question, like, what do you mean, do I agree with that? That's what
they're telling me.
That's what the doctor said, so that's what it must be. And I said to you at the time, no, it doesn't have to be that way. If you agree with that, then you're going to set yourself up for that. Right. So I came to understand that through my own healing of different injuries. And in some cases, the doctor would say, well, that's a very bad sprained ankle, that's going to take 6 months. And if I agreed with it, it would pretty much take 6 months. But I learned how to heal very quickly. And so the doctor said, well, that'll take 6 months. It took me less than 3. And it was, you know, everybody was sort of astonished, like how come you're healing so fast?
Right.
Because I'm being proactive. I'm taking charge of my focus, my energy, my intention. Whereas if you just abdicate your authority to what the doctor says, then you're not really initiating anything. You're just being passive.
Right. Okay, so first of all, what's your opinion on the advice that they get from their doctors?
I think they should always get a second, if not a third opinion.
Okay.
Because in my experience of working with cancer patients and post-surgical patients for almost 12 years, there's always another way to look at it. And I think it's good to get as much information as you can. So even 2 doctors in the same practice have different experience.
Right.
As to how long they've been working with this condition, or what they have seen, or how they were trained.
But your approach is similar to Kate's Holistic Healing, where we really do encourage people to follow their medical doctor's advice.
Of course.
And to do meditation as an adjunct.
Yes.
As a strong sort of
I would never tell anyone not to do what their doctor says.
Right. This is not
I would.
replacement.
I do encourage them to question the doctor, especially if they're not getting good, clear information. The doctor comes in and says, well, this is what you have and this is what we're going to do, and then they walk out of the room. I'm like, no, come back.
Right.
Why are we doing this? What is the efficacy of this strategy? You know, what's the track record of this drug? Doctors should know that, but interestingly enough, some of them don't. Some of them simply do, they follow a protocol.
Right.
And it could be the protocol of the hospital or that center, and in which case you're not going to get very much variance or information.
Yeah.
They're just going to say, well, this is what we do, this is how we always do it. So
right. And we've done this
just trust me, and
good with the questions.
but when you start questioning doctors, sometimes doctors don't like it. They get a little upset. Other doctors respond very favorably. They'll sit down and try to educate you, which I think the doctor should be educating you.
Right.
Understand?
And you should also be standing up for yourself enough that you ask him and try to get his time to get him to answer you.
Absolutely. And above all, I think it's important for the doctor to get to know you. Because as like my friend Michael, when he went into the hospital, they said, well, this is the average. And he said, but I'm not average. You know, I have tools that most people don't have. I know how to meditate. I know how to move my energy. I know how to conserve my energy. So you need to understand my approach here. And he was lucky that he met a doctor. His doctor took an interest. And he was able to educate her as to who he was and what tools and resources he had to work with. So if he got information that day that he found on the internet or from some friend, and the doctor came in and he said, sit down, I want to talk to you about this information I found. I want to know how you see it. I want to know, can we incorporate this?
Right.
So a good example would be nutrition. He found out a lot of nutritional advice for his condition. And he told the doctor, he said, I want to take these supplements.
But doesn't he find a resistance from the medical community?
Well, yes.
Because anytime you try to do it yourself.
Yes, absolutely.
Right.
So he said, I want to take these supplements. And they said, oh, no. You can't do that because we don't know what that is or how that works. And he said, well, let me ask you this. What food am I allowed to eat? And the doctor said, anything you want. And he said, well, so what's the difference if I'm taking a gram of curcumin or eating 2 pounds of broccoli, because that's the active ingredient. You know, that helps to fight cancer. And she was nonplussed. She couldn't answer that. He said, I'm not taking a drug. I'm taking a nutritional supplement. It's classified as food. So her response was, let's call the pharmacist in and have the pharmacist look at it. So he had a host of supplements. The pharmacist looked at them all and okayed several of them, but at very low dosages.
Yes.
And you know, he sort of really had to fight for it. When he started to really improve, and out of what they even considered to be possible within that time frame, he said, do you think what I am doing for myself is having the beneficial effect? Have you ever seen this happen with anybody else? And the answer was no. So then he said, well, do you think I can take more? And he fought for it. He got it.
Yeah. Well, that was what I had with you. I mean, the doctors kept saying, don't do this. You know, it's not going to help you. And then, you know, one round of chemo and I'm in complete remission and never expected it. So, so that was great that he stood up and he also had those skills going in.
Yeah. He also had a great support network.
Oh.
And this is one of the things that I do with cancer patients is I help them design a support network. And I work with the families, try to educate the families on how best to support. And then I look for alternative health providers that can become a part of that network, whether it's a chiropractor or a acupuncturist, an herbologist, a hypnotherapist, a nutritionist. I have, you know, people that I can recommend.
Right.
The more support you have, the better. Because some people, they're going to find out they have cancer, end up in the hospital, and it's just the patient and the hospital.
And that's it.
And that's it.
Else
And
involved.
I don't think that's enough support.
No.
You need emotional support. You need psychological support. You need spiritual support.
You need physical help when you're not feeling
Oh,
well.
absolutely.
You know. So,
Yeah.
no, it's very...
It's a fair amount of work
Right.
that has to go into it. So that's one of the things I do. And I sort of also work kind of like an advocate in which I teach them how to navigate the medical system. So as soon as a patient goes in the hospital, I say, now here's the thing. You really want to get to know the nurses and make sure that they see you as a person, you know? Like find a way to connect and find out something about that nurse because they're the first line of care for you. And if they see you as a person, not just as a patient, they will respond to you much faster and more efficiently. And if you're kind to them, and if you really take the time to give to them something, they will give it back in return. So
I've never heard advice like that. And nurses yield so much power.
yeah.
And to have them on your side makes all the difference to
Well,
us.
how many times a day are you going to see the doctor?
Right.
Maybe once. How often will you see those nurses?
Right.
Several times a day. They're going to come in to give you medication, to, you know, change things and clean you up. And so you really have to understand that if you treat them poorly, then you're going to be treated with less care.
Right.
So.
But, okay, but back with the meditation. When you treat people, do you find that it's better if they're undergoing chemo, radiation, surgery? Does it make a difference?
With what I do with that?
Yes.
No, doesn't make any difference.
So, for example, could you just like walk through what do you do if someone's doing chemo? What would you have them do?
First of all, I teach them how to charge the chemotherapy solution. And this comes from Tibetan medicine. It's something I learned a long time ago. In the tradition of Tibetan medicine, when they make a medicine, they are infusing intention, prayer, into the medication. Essentially what they're doing is programming it, telling it exactly what they want the medicine to do. So when my friend went in the hospital, I said, as soon as they bring in that chemo, take a minute and just talk to it and tell it, I want you to kill the cancer cells and leave the healthy cells alone, and then leave my body.
And that's what I always did to the bag of chemo, put my hands around it.
Thank you very much.
Right.
Yeah,
Talk to
absolutely.
body,
Some people are so afraid of it.
Right, and it's not. It's your defense.
Yeah, it's there to assist you,
Yes.
and you have to have a relationship with it.
Right.
So being able to talk to that chemo, understand that, and then while they're accepting that chemo, I'll give them different types of exercises, of meditations to do.
Such as?
Breathing,
Okay.
first and foremost. If you know how to breathe correctly and efficiently, you're going to have more energy, and energy is the currency of health and healing. If you don't have enough energy, you're not going to heal, period. And this is one of the problems with chemotherapy, is it really zaps your energy. And you have to have a period of time to recover. And oftentimes you'll go through a round of chemo and it'll really take the energy out of you. And just as your energy is starting to pick up, they want to give you another round. And so some patients actually die from the treatment because their energy is never allowed to build up again. So breathing is your primary source of energy. Okay?
So
primary source of energy. So I teach people how to breathe correctly first and to understand the value of that breath. Every single breath is an energy potential. Okay? And you want as much energy as you can get so your body can fight well. Understand? If you're weak and depleted, you're not going to have the resources to fight the cancer.
So after you've talked to them about the breathing.
Breathing, and then how to focus. How to focus. So I teach something where I say, soften, smile, breathe. You want to be as soft as you can, as fluid as you can, as receptive as you can be. You don't want to be in fear and resistance. You want to be open and receptive. To get that way, you have to find a soft focus in your eyes, just like you have right now. So we call that the inner smile in Taoist esoteric yoga. So we say, soften, smile, breathe, and receive that energy through that breath. Receive that medication, receive that nutrition, receive this support from this person. And as simple as that is really powerful and profound. Because most people, when they're not well, are very frightened. And that fear creates a very strong field of defensive energy. So not much is going to come through that. You have to learn how to soften the fear, and you have to learn to breathe with it and express it, so that you can change that fear into at least a neutral state of acceptance.
And that's what you need. You can't hate the body part of you that has cancer because it's you. Right.
You got to love
you. Really
you.
Do.
You have to love yourself, and you have to love this experience. So from a spiritual perspective, what I'm doing is trying to get people to understand this is a great opportunity for growth. Your condition, this hospital, this treatment, this is one of the most wonderful opportunities to grow in terms of awareness and understanding about yourself. If you want to work that way. If you want to work that way, I'd love to work with you and guide you. If that's not the way you want to work, then we'll find somebody that might be better suited. Because that really is my goal.
Because of medicine, you go and you see your doctor for 5, 7, 10 minutes. How long are sessions with you?
Hour minimum.
Okay.
Yeah, I'll sit and we'll breathe together, and we'll focus, and we'll move energy very gently. We'll focus on what we wish to create in the body instead of what we don't want to have.
And what if someone's going through cancer and they're too sick to get to you?
Well, I go to them. I go to the hospitals all the time. Most of my clients that I see are in-home or in the hospital. I have several office spaces, but when I'm working with a cancer patient or a post-surgical patient, they're not going to be able to travel. So I travel to them.
That is fantastic. And how has your track record been?
Very good. Very good. Well, I mean, you're one of the best examples.
It still amazes my doctor.
Yeah, and I still talk about you all the time. Because what you did was take the authority back for yourself.
That was the empowering.
That was the empowering part of it. You were giving your authority to the doctor. Doctor says, this is what's going to happen, this is how long I'm going to live, so be it. And then we challenged that notion, and then we added another element to it, which is you're in charge. What do you want? Do you want to live? Do you want to die? Do you want to die in a year? It's up to you. It's not up to anybody else. Because I've seen people heal from cancers and all sorts of interesting things, whereas the doctor is just going, well, I don't know how that happened. But it happens.
It does, and happens frequently enough.
Yeah. There's a book that I often recommend called Radical Remission. And I found that book about a year ago, and I read it through, and I thought this is a great resource, and I recommend it to all cancer patients. And what it's about are a doctor who's a cancer oncologist. She studied hundreds and hundreds of cases of radical remissions. And then she interviewed hundreds of people, and she found something like almost 80 different elements that were similar and narrowed it down to 12. So these are the 12 most common things that all of these people have in common that were able to heal themselves.
Okay.
And this is stuff that each person can do. They can learn to meditate, they can learn to eat better, they can take command of their focus and their intention. They can incorporate other things that they find feed them, give them more energy, whether it's listening to inspirational music or reading inspirational material or working on their relationships. You know, all of that affects the health. So there's plenty that people can do. And getting back to your question, my track record's been great. I've had 2 people pass away. One was a gentleman in his late 80s who had cancer for 30 years. When I met him, he was really languishing. He had an open wound in his back with a pump installed. He just had another one of many, many surgeries. But his wound wasn't healing. And so when I met him at home in a wheelchair, and I took one look at him and I said, you need to work on building your energy up before anything else. So I taught him how to breathe, I taught him how to focus, and even within that first session, he had more of an appetite, he had more energy.
Huh.
So he said, I want to work with you 3 times a week, which we did, and within, I think it was about 6 weeks, that wound healed. And that was really not healing for about 6 weeks.
Yeah.
So once that happened, I said, now let's work on getting more energy and more strength. We started doing like Qigong exercises where I could get him to stand up and bend his knees and breathe and hold those postures for a while and then sit back down again. Got to the point where he could actually walk again.
Yeah.
And I would take him outside, take him for walks. You know, he had a walker. We go to the park and do our exercises. I worked with him for a little over 2 years. And then his condition and, you know, and his age were a big factor.
Right.
When he passed away, his family came up to me and said, you know, you gave him extra 2 years because he would not have even lived that long.
Right.
So even though someone may pass away, I feel like, can we get the most out of the time you have?
Yeah.
That's what I'm really going for. Can you strengthen your relationships with your loved ones? Can you look at this as an opportunity for growth? And can you incorporate a couple of things that might help build you up and give you a better quality of life?
Which is basically the definition of holistic healing.
Yeah.
You include everything.
If it works,
Right.
yeah. The person has to be receptive. They have to be open to it.
So that's the other thing. I mean, how effective is it on people? Do people have to have some experience with meditation?
No, most people I work with do not. So I teach them how to meditate.
Okay.
I can teach people how to meditate in literally 15 minutes. It's not difficult, you know. And there are many different types of form of meditation. And I'm skilled in probably a dozen or so. But I always start with a very simple breathing meditation because you have to breathe. So if we focus on just breathing and receiving that energy and storing it in the body and letting it build up in the body, that becomes a very simple form of meditation. It also helps them to negate a lot of the anxiety and a lot of the fear. Because if you're really focused on breathing, you're not focused on your worst case scenario, you know. So that's one of the benefits of meditation. Meditation is one way that it helps with cancer, is to help a person focus, to have a singular point of focus in which they're not constantly reacting to their fears or to the what-if scenario, okay? In addition, meditation can help a person begin to program the body, kind of like positive affirmation and visualization. Those are all components of different types of meditation. So seeing your body healing, visualizing it, intending it, affirming it, really, really powerful. There have been plenty of scientific studies that show people who have a positive outlook, use positive affirmation and prayer, have a much higher success rate at healing than people that don't. So, but, I mean, we've known this for thousands of years.
Right.
You know, in many different cultures and traditions, they have specific images that they want a person to focus on while they're healing. And that helps to train their attention and keep it from wandering, keep them from becoming overwhelmed by fear and anxiety.
Mm-hmm.
So that's just one aspect of it. Also just helps to relax a person. Physically, you have to be able to relax. You can't relax physically until you can calm your mind and just keep it centered for a period of time.
So what do you find your biggest challenge? Convincing people of its efficacy?
I don't try to convince people of anything. What I often do is I'll relate stories, personal stories, of how I have used the tools and techniques that I teach. And I'll talk about people like you and people like my friend Michael that that have had wonderful results, you know, and have been able to heal. So if they hear that that's possible, then they sort of convince themselves, yeah, I really want to do this. It can't hurt,
Right.
you know.
Well, if someone wanted to get in contact with you, how would they? You can go on Kate's Holistic Healing website, and Ron Navarre's information is there. Or they can reach you at Stress Defense.
Yeah, stressdefense.com.
Okay. And thank you very much for coming in and sharing all your wisdom on cancer.
It's been my pleasure.
Thank you. And if any of you out there have friends, keep in mind meditation is a great adjunct. Kept me alive. Thank you for joining us today, and we will see you next time on Kate's Holistic Healing.